Stephen, hi. Welcome to
Hi.
our live TikTok session on Fly FM. We do this called hashtag health check. And of course, today is a very, very important night, I feel, with you, Doctor, because we will be talking about mental health. Doctor, I just want to know, you're actually from the Mind faculty. Can you tell us a little bit more about the Mind faculty?
The Mind faculty was started by three of
Mm-hmm.
us who thought that we should have a one-stop center for psychiatry, psychology, therapy, behavioral therapy, family therapy, couples therapy. So all in one go.
That's really, really amazing, Stephen. With the pandemic happening right now, I feel like it's affecting a lot of people,
Mm-hmm.
especially mentally. So I think we can start off with answering this question, and I think a lot of people don't really know what exactly it is. But Stephen, can you tell us what is mental health?
Okay, according to WHO, the World Health Organization, health is just not the absence of illness, but also physical well-being and mental well-being. Mental health means being happy with yourself, being happy with others, and others being happy with you.
Right,
Yeah, I might be fine about myself, but if people don't like me, it's a problem.
right. What are some of the warning signs of mental illnesses that we need to look out for?
Personal discomfort, interpersonal problems, and functionality. Those three domains. Yeah. So if I'm not happy about myself, or if my friends say, "Hey, Steven, what's wrong with you?"
Right.
Or if my boss says, "Hey, your kerja ni tak jalan, something's wrong." Yeah.
Oh,
So
faham.
then something is wrong. Yeah.
Stephen, I feel like a lot of us are afraid to really talk about how we feel, especially when it comes to mental health, in Malaysia, because a lot of us feel
Mm-hmm.
like it's taboo, or a lot of us feel like, oh, it's probably nothing, like, I'll get over it tomorrow, kind of thing. So, what is your advice to people who are afraid to kind of speak up about how they feel?
People are afraid because it affects our persona. If your leg is broken, they'll say, "Oh, go to the hospital, take an X-ray, and take a cast." But
Right.
if it's yeah, tapi if it's a depression, they'll say, "Oh, fight it out, snap out of it." For heaven's sake, snap out of it is the worst thing you can ever say.
That is going to be off my vocabulary, like that whole sentence just.
Please do. Yeah.
Yeah, I think the fact that people tell you things like that, of course, is gonna make you hide about it more, and you wouldn't want to talk about it,
Exactly.
right? Stephen, actually, we got somebody in the comments, Nikila. She wanted to know. She always wanted to try therapy. What can we expect from the first session? Oh, that's a good question.
From the first session to know what condition you have or what's your problem, and also in the first session to get comfortable with your therapist. Yeah, that's about it. It's simple. People come to see psychiatrists, psychologists, psychotherapists, expecting to perform or to deliver. No lah, just come lah.
Okay, that's great. That's really good to hear, because I think a lot of people are very scared, but knowing that it's going to be a safe place, I think hopefully a lot of people will actually go through that first session if they need to anyway. Steven, I feel like stress is something that we
Why?
all go through. Oh no, like stress lah in general. Is
Okay.
everybody goes through stress, but is stress mental illness? Could it be mental illness?
Okay, now stress, um, good stress helps us work better. But when it becomes a bad stress, it becomes distress. Then we don't function, we don't interact, we don't feel good about ourselves. Yeah. So there's a kind of curve. So stress is good to a certain extent.
We actually want to know right now, Steven, can you actually prevent mental health problems?
Yes, sounds a bit boring because I always speak of this. It's called biopsychosocial, biological, psychological, and environmental. If we do the right things, exercise and not work after 8 o'clock.
Alam-
Yeah.
okay.
And yeah, so we can prevent looking for wrong coping mechanisms.
Okay, so even like the simplest thing, like having a healthy meal today, can really help prevent that.
A good, nice meal, not thinking about work or stress, just thinking about the meal to cope. Yes.
We were talking about prevention of mental health, Steven. Now we kind of want to go into cures. Are there cures for mental health problems?
Okay. Yes. So some mental health problems may require medication. Mental health problems will require therapy. So sometimes with medication and therapy, sometimes with just therapy alone. And yes, it can be treated. Sad to say, but the rise of self-harm, the rise of suicide is because more people are having increasing mental health challenges. They putus asa lah, they give up. What we lack is the awareness that we can help. There are treatments.
Of course, mental health is a super important topic to talk to. So I'm just so happy that we're having this session right now. Can I have an elaboration on anxiety and how do we cure it or reduce it?
Anxiety can be to a particular issue, or it can be generalized. How do we cure it? We learn how to relax, identify what our stresses are, and change it. There is something called cognitive behavioral therapy, where we change the way we think and what we do, and that changes our mood. I shall wake up earlier, go for a nice walk, come back, have a cup of tea, and plan my day, and things will be better. Otherwise, work. There you go, it's a vicious cycle. This goes round and round and round.
Any tips on how to have positive thinking during the pandemic?
We are learning new things. Okay, financially, we're having problems. Socially, we're having problems. But we are learning new things. Now, the next time we have a pandemic, we're going to know what a pandemic is about. We are now better than we were a year ago. We are learning how to communicate and speak to people. I make 3 or 4 phone calls a day to my friends whom I don't normally do. When our friends reach out now, I call back. So we are learning new skills. So it's not good. The pandemic is not good. But we can make something good out of it.
That is very true, Stephen. That kind of reminds me of as well, like nothing lasts forever, in a sense that even the bad times will not last forever as well.
Yes.
Thank you so much, Stephen, again, for really spending your time with us talking about mental health. You can always find Stephen at the Mind Faculty on their website. You can also find them on Facebook as well. Stephen, thank you so much again for doing this session with us on Fly FM. We really, really appreciate your time.
Such a pleasure.
Thank you so much. Take care and stay safe.
Yeah, take care. Bye.
Fly FM.